Hey, I'm Dr. Arzate, diplomate of the American Board of Oral Implantologists, the ABOI, and I have the honor to have here with me Dr. John Minichetti, the implant daddy. How are you?
Thank you, Dr. Arzate. Thank you for having me.
Oh,
Thank
it's
you
a
for your
privilege.
hospitality here in Cancun.
Well,
it's a
it's-
beautiful clinic.
Thank you, thank you, my friend, for coming all the way from New York.
Yes.
And to visit here from this surgical course that we give
Yes.
in my office.
Yes.
And we thought that it was going to be interesting to talk a little bit more, to share with doctors out there
Correct.
that they are thinking about doing credentialing.
Yes.
And why the AAID? Why the ABOI? I mean, it's like, what can you tell us about
Yeah,
it?
think about that. Well, credentialing is something that you might want to consider as a dentist getting involved with implant dentistry. I mean, it has a couple of good benefits to it. Number one, it's going to force you or encourage you to study, to update yourself, to become the latest in technology, to understand the latest theory and techniques. So it's a good motivating factor for each individual dentist. And then also, too, it's a good thing for the public. And when you have a credential and you're practicing in the public's eye, they can look at you and say, gee, that doctor is certified in the knowledge he has and the clinical experience he has in implant dentistry.
So do you think all doctors that they pretend to go through implant, I mean, they're thinking about starting to go into the implant world, they should credential?
I think that all doctors that want to get serious about doing both the prosthetic and surgical aspects of implant dentistry should set goals to get certified in implant dentistry.
Okay.
And one of the best organizations for that is the American Academy of Implant Dentistry.
Which you are the past president.
Yeah, actually, I'm the past president. I'm a little bit biased about that, but I could say that it's the oldest organization in dentistry. It has the greatest members that are general dentists who are performing both the surgical and prosthetics, not just one aspect of treatment. And they have been validated in the United States as a recognized credentialing organization. That fellowship examination, the associate fellowship examination, most states now in the United States will recognize and allow members to advertise that they are credentialed with the American Academy of Implant Dentistry.
That's very interesting.
Yes.
Now tell me the difference between being an associate fellow, and then going all the way to the ABOI to be a diplomate. What could be
Yes.
the difference so they can understand a little bit?
Okay, well, you know, all the implant or all the dental specialties have two components. One is a membership component, such as the American Academy of Periodontology, and then a boarding component, which is the American Board of Periodontology. So the boarding component is separate from the membership. Membership, you pay dues. Membership, you can get credentials or awards. But when you go to a boarding organization, they're there just to test you whether you're a member or not a member. They're there to test you on your ability and your clinical knowledge in that specialty field, whether it be oral surgery, periodontology, or in this case, implant dentistry. So the American Board of Oral Implantology is an organization well over 35 years, and it's the validated certifying board for dental implant specialty in the United States.
Wow.
Yeah.
Well, that's nice to hear from you because once doctors start to go like a little bit more like, hey, I should go for implantology, probably they do not imagine how much they need to learn.
Correct.
How much time they need to put on it, because just to be a fellow, you need to go to 300 CE hours, no? That's
Correct.
the
Yes.
only
So we
one
have
that-
different levels in our organization. So on the credentialing side, the way to get started for most members is to get their 300 hours of continuing education in oral implantology and apply to become an associate fellow. So that's the entry point into the credentialing system. Once they get that associate fellow, they can actually get more credentialing hours and become a fellow, or then become a diplomat. So diplomat has years of experience, more clinical cases that need to be presented. It has an oral examination board.
Well, that's what I did.
Yes, that's right.
That's what I did, and
As you know.
it was tough. It
As
was
you
tough
know.
because you're gonna find lots of Dr. Minichettis out there in the ABOI, and they are. How many years placing implants you have been doing?
Oh, I've been placing implants for over 35 years.
So imagine the knowledge. Imagine the knowledge and going through those examinations. It's a tough one, but it's worth it.
Yes.
So if you're thinking about doing this, going through that path from the AID, the ABOI, it's really worth it.
I think it's very good. And in our organization, the American Board of Oral Implantology, we have other specialists come to our organization to get certified in implantology. So we have oral surgeons who are dual boarded in oral surgery and implantology, prosthodontists who are dual certified, etc., and also periodontists. And I've heard some of those specialists say to me, when going through the process of taking that exam made them a better oral surgeon or a better prosthodontist, because they really had to expand their knowledge outside their specialty field.
Absolutely.
Yes.
Well, I feel so happy to have you here.
My
And
pleasure.
Thank you for all your time that you have spent for
My
the
pleasure.
implant world, because it's worth it.
Thank you so much for being
It's
a good
an honor.
friend and a good colleague.
Thank you.
Appreciate it.
Thank you. Bye-bye. See
Bye.
ya.